Hi, my name is Shania, and I'll be doing my head to toe assessment. So, the first thing we would do is I would gather all my supplies. I would perform hand hygiene. Then, once I enter into the patient's room, I would provide privacy and I would introduce myself. Hi, my name is Shania. I'm going to be your nurse, and today I'll be doing a head to toe assessment on you. So, I'll have to touch you in a couple areas just to see if there's any lesions or mass on your skin, and I'll also have to use my stethoscope to listen to some things. Is that all right?
That's fine.
Awesome. And do you have any questions?
No.
Okay, great. So what's your name and what is your birthday?
I'm Noor, and my birthday is October 7th, 1990.
Awesome. Okay, great. And also, Noor, I can just tell by looking at her that she's well groomed. She is wearing the appropriate clothes for the weather, and she is well nourished. So I'm going to ask you a couple of questions also, and if you could answer it, that would be great.
Sure.
So, what month is it?
April.
Where are we?
We are in the hospital.
And why have you came in?
Just for my checkup.
And then also, what did you eat this morning?
Bowl of cereal.
Okay, great. Awesome. So that means that my patient is oriented ×4. And now I'm going to ask if you are feeling any pain today on a scale from 1 to 10, 10 being the worst pain, how would you rate it yourself?
At a 1.
1? Okay, good. Good to hear. So next I will be assessing the skin integrity of my patient. So, do you have any cuts or bruises anywhere?
No.
Okay, great. And just by looking at your skin color, I can tell you're appropriate for your racial heritage. Your skin texture is smooth and has even surfaces. Your skin feels warm temperature and the moisture is dry. And by looking at your skin, I don't see any lesions or any masses or any rashes. So we're good there. So after I've done that, I will now assess my patient's vital signs. So the first thing I would do is I would assess your temperature, your pulse, your respirations, your blood pressure, and I would also assess your pain level, which we already did. And then I would use a pulse ox, and I would put it on your finger, and I would check the levels of oxygen in your blood. So I don't have a pulse ox, so we're not going to do that, but if it was normal, it would be 94 to 100. So we're good there. And now I'm going to be assessing your nerves, okay? And I'm going to ask you a couple questions and you to do a couple things.
Okay.
So the first nerve I'm going to assess would be your olfactory nerve, which is the first nerve. And are you congested at all?
No.
Okay, are you having any sinus problems?
No.
Do you have any breathing problems through your nose at all, usually?
Nope, not
No?
usually.
Okay, can you hold one finger to your nose and breathe out the other? Okay. Good, and can you do the other one? Okay, great. So it seems like your nose airways are clear. And now I'm going to do nerve 2, which is your optic nerve. Do you wear glasses or contacts at all?
No.
No? Okay, great. So the third nerve I would do would be the oculomotor nerve, and that's where I will be assessing her pupils. So just by looking at her pupils, I can tell that they are round and equal. And now I'm going to shine a light in your eye, okay? Okay. Pupils react to light. Awesome. And now nerve 4 is the nerve that controls rational movement, is the trochlear nerve. So I'm gonna ask you to follow this pen for me. And so I'm gonna go up. And then nerve 6 is the abducton, which is the lateral one. And then I'm going to bring it in. And if you can look for me. And then her eyes are accommodating bilaterally, which is great. So can I look at your sclera? Sclera is white. Okay, great, awesome. So now I'm going to be looking at nerves 5, 7, 8, and 11. So nerve 5 is your trigeminal nerve, and that nerve, it shows you the sensation. It allows you to feel the sensations in your face and the motor functions in your face. So then nerve 7 is your facial nerves. So can you puff your cheeks out for me? And then can you smile? And then can you squint your eyebrows? And then can I tickle your face if that's okay?
Sure.
And and what do you feel?
You tickling my face.
Okay, great. Okay, so after the facial nerve is nerve 8. That's the vestibulocochlear nerve. And that nerve, if I had a tuning fork, I would, sorry, I was checking the time. I would tap it against my patient and see what noise it makes. And then nerve 7 and nerve 8 is the nerve 8 is the vestibulocochlear nerve. Nerve 11 now is your spinal accessory nerve. So can you take your hands to your shoulders right up here? Shrug your shoulders. Okay, good. And then push your neck to this side and to that side. Okay, good strength in your shoulders and your necks.
Yep.
Okay, great, awesome. So that was nerve 11. And now we're going to do nerve 9, 10, and 12. So nerve 9 is your glossopharyngeal nerve. So that is where, if you can open your mouth, I would use a tongue blade, and then I want you to say ah. Okay, the uvula is raised and is in the center of her mouth, which is great. So then nerve 10 is the vagus nerve. So that nerve is when you assess the chewing and swallowing of the patient. So do you have any problems chewing or swallowing?
Nope. No?
Okay, great. So then finally, nerve 12 is the hypoglossal nerve, and that is when if you could stick your tongue out for me, and can you lift it up, and to the side, and to the other. Good, awesome. Good range of motion, great. And so now I will be assessing her head and palpating her head. So, with the head assessment, you would basically feel for lesions, any masses. With her hair, I would be looking if there's any infestations, and there's not. Her hair is well groomed, clean. Okay, good. And now for your face, there's no lesions, there's no masses. Is that okay if I touch your nose? No swelling, and your sinuses, and your eyebrows. Good. Okay, and then can you open your mouth for me?
Sure.
Okay, so I'm just gonna be looking in your mouth. Tongue is pink, teeth are clean, gingiva is pink, and pretty good there. So let me just fix this really fast. Okay. So now I'm going to be assessing your neck, okay? So basically, first I'm going to palpate your lymph nodes. So I'm just going to touch your lymph nodes. So no swelling and no masses and no hardness. Alrighty, good. And the trachea is midline as well. I'm gonna just close this a little more, sorry. Okay, and now I'm gonna auscultate and listen to your carotid artery with both the bell and the diaphragm. So, good. Oh. Okay, great. So now I'm going to palpate both your carotid arteries and just check your pulse. So I'm not going to do it at the same time, but sorry. The other side. Okay, so pulse rate is 2 plus bilaterally, so that's great. And now finally, I'm going to ask you to move your neck up and back and side to side. Okay, full range of motion of the neck. Anything hurt at all when you do that?
No.
Okay, great. So let me just fix this. Okay, now I'm gonna do your upper extremities. Hold on. Let me just scooch this. Ooh, let me scooch this just a little more down. Sorry. So now I'm gonna be looking at your upper extremities. So first I'm just gonna look at her skin, make sure there's no lesions, no muscle mass, no rashes, nothing on her skin. She's good. I'm gonna look at the color. The color is appropriate for your racial heritage. Smoothness. Your skin is smooth and has even surfaces. It's warm to touch and it's dry. And let me check your turgor. Okay, great. Good turgor. And now, so I'm gonna have you do a couple things. So can you stick your arms out to me like this? And can you rotate your arms up and back down? Okay, good. And now can you touch the tips of your fingers and then go back afterwards? Okay, great. So now you can bend. I'm gonna check your capillary refill. Okay, less than 2 seconds, great. And now I'm going to, I'm gonna have you push it, I'm gonna have you squeeze my hands as hard as you can. Okay, good hand grip. And now I'm gonna push against you and I want you to push against me. Okay, so ready? 1, 2, 3. Okay, great force. Okay, do you think you can stand up for me? Here, I'm gonna tilt this up a little bit. And can you put your arms straight for me? Like this. So I want you to close your eyes. And I'm looking to see if there's any drifting or any tremors of the hands. So, and then of course I would also monitor to see if my patient's swaying, and I would make sure if she is swaying, I would sit her down right away. Okay, great. So you can just sit down. And then finally, I'm going to flex your elbow. So bring it up. 1, 2. I'm gonna come across. 1, 2. Awesome. Ow. Okay. Up. Sorry. 2. No grating. Great. And finally, I'm going to look at your hands, please. No beautiful hands. No abnormalities, no deformalities, or no anomalies, no deformities. Fingertips are clean and good and cut and round, and no clubbing. So great, awesome. So now I am going to do your thorax. So I'm gonna actually have you move a little closer to the screen. Sorry.
A second.
A little more, sorry. Oh, I'm sorry. I forgot to do one thing for the upper extremities. So I'm going to be doing your pulse. So I would be testing your radial pulse, 2 plus bilaterally, and your brachial artery. Sorry. Okay, 2 plus bilaterally. Okay, great. Sorry about that. So now I'm going to do your thorax. So first I would look to see if there's any lesions, any masses. If we were in a clinic, I would ask you to take your shirt off so it would help me to listen to her heart better. But we're just gonna assume that she has no lesions and no masses. And I'm gonna check your skin turgor. Okay, awesome. So now I'm going to listen to the 5. I'm going to auscultate to the 5 points of the heart. So first, with both sides of the stethoscope. Okay, so first, I would go second intercostal down. Okay. And just go directly across. And this is the aorta. This is the pulmonic valve. We have Erb's point. the mitral valve right here, and then if you could lift your breast up for me on this side, and then the apical valves. Okay, and now I'm gonna do it with the bell as well. So, second intercostal down. Okay. Herb's point. Sorry.
Okay.
Let me know if you're uncomfortable. And then we have the mitral valve. And then we have our apical pulse, excuse me. Okay, so now I'm going to listen to your apical pulse, okay, for a full minute.
Okay.
Okay, so.
That's one under here.
Mm-hmm. Thank you, sorry. Okay, so ready? Okay, I got 86, and pulse was also, heart rate was also regular with a regular rhythm. Okay, and finally, I will now be listening to both sides of your lungs, okay? Posterior and anterior, okay? So, with both the bell and the diaphragm. So, first I'm gonna start here. Okay, so. And do deep breaths, please. Sorry. And she has a small torso, so I'll be listening to the lower lobe back here. And it would work best, obviously, if her shirt was taken off. But we're not going to do that. Okay, good. Now I'm going to do with the bell, please. Sorry. Okay, you're good. Okay. So. Okay, so on both sides, no wheezing, no crackling, good. And now I'm going to be doing your back, please. So if we could turn you a little bit. And I'm going to switch my computer. Yes. Can we turn you a little more? I'm sorry. Damn, we're at 20 minutes. Okay, and to face the computer, or with your back. Sorry.
Oh, sorry.
You're good. Okay, so now I'm going to be listening to the back. So, excuse me, sorry. So I'm going to start in the midline, near the midline, in between the scapula. And just do normal breaths for me. Excuse me. Now I'm going to be doing it with the bell as well. Okay. Okay. All good. Awesome. So we're going to turn you back around. And now I'm going to assess your abdomen. And we won't show your belly to the camera, don't worry. But if you sit down, please, Marie. Perfect. So the way we would assess the abdomen is first we would assess if there's any gross anomalies and both your chest and your abdomen look symmetrical, which is nice. So the first thing we inspected, which I noted, and your belly is flat, which is good. Now I'm going to auscultate and listen to your belly sounds. So I'm going to start in the right lower quadrant. And of course, it's easier when you're not wearing any clothes, but here, I'm actually gonna, sorry. Good, I hear movement. Okay. I would also ask my patient if she has any stomach problems and also when the last time she had a bowel movement was.
No stomach problems in, I want to say, a couple hours ago.
Okay, and now if it's okay, I'm going to actually percuss, which means I'm going to tap on your belly, on each quadrant of your belly. So I'm going to start in the lower right quadrant. So, sorry. Good. Okay, and now finally, I'm going to palpate your belly. So if you feel any pain, let me know. I'm just going to be looking for lesions or any masses or lumps or anything. So if you feel pain, let me know. So Okay, feels good. No bumps, no masses, no pain, right?
Nope.
Okay, great. So now I'm going to be assessing your femoral pulses. So I would check right here. And I would also look to see if there's any hernias. And it's a little easier when you lay down, but...
Do you lay down on the chair?
No. Okay. Regular rhythm, 2 plus bilaterally. And next I would assess the genitals, but we're not going to do that obviously. So I would check for appearance. I would check to see if there's any odor, any drainage, or if there's any tubes, presence of tubes. So that's what I would do. And finally, I'm going to assess the lower extremities. So we'll have you sit down and then I'm going to have you lay down if that's all right. Okay, so first I'm going to assess I'm going to look at the skin. Your skin is appropriate for the color is appropriate for your racial heritage. There's no hair growth because your legs are shaved. Your toenails are clean, they're cut, there's no ingrowth. Texture wise, it's pretty smooth. And here, I'm sorry actually. Texture wise, it's smooth, and then it's dry as well, which is good, and there's no lesions and no masses. And I would also check for edema, or if there was any swelling in the legs. Okay, so now I'm going to palpate your pulses. So first I would do the popliteal behind the knee. Could you scooch forward a little bit for me? I'm sorry. So popliteal. Then I will do the posterior tibialis. +2 bilaterally. And then I will do dorsalis pediis. Okay, good. +2 bilaterally. So I'm also going to check your capillary fill on your toes. So, okay, less than 3 seconds. Good. And now I'm going to have you lay down, please, for me. Sorry, on the floor. Here. And I'm going to be moving your...
This way?
Yeah, just like facing the camera. Yeah. So I'm going to be checking the abduction and adduction of your hip. So I'm going to move this leg. You see me good? My computer to fall.
Did you move back?
No, you're good. So, oh, I'm sorry.
That's fine.
So I'm going to move your leg laterally. And now I'm going to cross. Good. Good range of motion. Now I'm going to get... Oh, it froze.
What? Not again.
No. No.